Uganda is pushing to strengthen its health system through public-private partnerships. According to the Ministry of Health, the growing role of private hospitals in improving access to healthcare at community level cannot be undermined. The Commissioner in charge of Reproductive and Infant Health at the Ministry, Dr. Richard Mugahi, made the remarks after opening a new fertility and maternal health facility, Bethany Hospital, in Chira.
Uganda posts the best maternal and child health statistics in East Africa. Not even the countries that are richer than us. We first, that is in the recent UN report, we post the best statistics in the East African region. So I'm really proud that our model of service, where the government works with the private, there's also another group called private not-for-profit. Private not-for-profit, those are the 5 best organizations. They really do a good work, and to manage a delivery rate of close to 2 million babies a year.
Dr. Mugahi says private sector investment remains critical as government facilities continue to grapple with staff shortages, limited infrastructure, and increasing patient numbers.
When the private sector is able to invest in fertility, it helps government to improve, to close that gap of supporting our people, because government is not yet offering this service at regional level. It's only in Mulago, and that's why we are offering the service. So what we see now is that the service is still expensive because the equipment, the investment in the equipment is very expensive. On average between 15 and 20 million shillings, and that's quite high for an ordinary couple. So we are trying to discuss as government to see how can this be subsidized. So government is looking at one, coming up with a bill, a law to regulate the practice of human fertility. It's already in place. We have moved miles. The principles of the bill have already been drafted. We are going through stages of approval. We are also going to see how the cost of these human fertility procedures can be greatly subsidized to be more affordable. For example, if we have an overbank, if we have a bank for eggs in Mulago and sperms in Mulago, we don't need another bank within Kampala. That bank is enough. The fridges are sorted and the government has bought them.
The director of the hospital, Dr. Gonzaga Andabati, explains that their focus on fertility and maternal and newborn care is a reflection of the rising demand of quality services from the public.
The gap is there in maternal child health, but in particular in relation to infertility treatment, because as we see now, currently government center which is running fertility treatment, there's only one which has just started recently, and so we know it takes time to establish a good fertility center for it to achieve a good success rate. And so there is still going to be a learning curve on the side of government, I can assure you, but there is a gap which we must fill.
Bethany Hospital Management says the facility will also serve as a training site for health workers and create employment opportunities for medical professionals in the area.
Now there are some more advanced problems which we see we must attend to. For example, issues to do with the sperm factor. But our idea is also to progress further in the very, very near future into genetic screening for these fertility patients. We're in the process of establishing that genetic lab. I think before the middle of next year, it should be up and running. Now, what this genetic lab will be doing specifically will be to screen our embryos before we do the embryo transfers in IVF treatment. We will also be able to test for genetic abnormalities, for example, sickle cell.
Both doctors, Andabati and Mugahi, acknowledged the need to subsidize the cost of key services like fertility treatments to enable the wider population access to quality care.
We've come up with some measures. For example, towards the end of the year, we do a cost reduction. We engage our partners, the suppliers, to have a cost reduction on the supplies, and we transfer that onto our clients. But we still have a very huge challenge in procurement of items that we need. They often have to spend a lot of time in their clearance areas. For example, recently we had IVF media we were importing from Vitalife. These are these are close to live media. What I mean is media which is made fresh from the factory. They are supposed to be brought and be used. Their expiry dates are always short by design because they have living molecules. And so they can never be made with the preservatives to last for over a year. So when this passes through the customs, you find NDS saying that the law does not allow any item with this type of expiry date. So they hold it, and you have to explain. They are like, no, they are following the law, and even so, we've had a lot of challenges with that. So I think they have to do a policy revision. They have to be flexible, and I hope they can have scientists who understand science to work with us.
Walter Mwesije, NTV.